Mass casualty incidents presented by Stephen Allen, Melissa Smith, and Isaac and Zay Williams, students of Lake Technical College, PST Fall 2025. A mass casualty incident is any localized incident in which there are three or more people who die. It is any incident that requires more emergency response units than a given city or town has. It is any incident that results in a sudden surge of injured or ill people requesting emergency services within a given locale. All these criteria must be met for the event to be a true MCI. There are four types of mass casualty incidents. This includes natural disasters, accidental or unintentional, man-made or intentional, and health-related. Examples of natural disasters include hurricanes, floods, and tornadoes. Examples of accidental incidents include multiple vehicle collisions, plane crashes, and structure fires. Examples of man-made incidents include mass shootings, vehicle ramming attacks, and missile attacks. And health-related MCIs are epidemics and pandemics. Examples of mass casualty incidents in Florida's history. Lake Okeechobee Hurricane, September 17, 1928. At least 4,114 casualties. Storm of the Century, March 12, 1993. Between 270 and 318 casualties. Examples of accidental incidents. ValueJet Airlines Flight 592, Everglades, Florida, May 11, 1996. 110 casualties. Sunshine Skyway Bridge Collapse, Tampa, Florida, May 9, 1980. 35 casualties. Man-made incidents. Littlefield Nursing Home Fire. Arson, Largo, Florida, March 29, 1953. 34 casualties. Pulse nightclub shooting. Orlando, Florida, June 12, 2016. 49 casualties. Health-related MCIs are not true MCIs because these are not single events. However, these events still result in a large amount of people who die. The COVID-19 pandemic has killed approximately 89,075 people between 2020 through 2023. The opioid epidemic killed an estimated 80,000 people in 2024 alone. The challenges of mass casualty incidents involve social organization, establishing trust, leadership, delegation of responsibilities in a command structure, resource management, having adequate medics, healthcare workers, medical equipment, and basic supplies such as food, water, and shelter. Information dissemination, having an efficient and effective means of communication and flow of information. Logistics, ensuring the victims, patients, and responders have access to the resources they need. And economic cost, have an adequate insurance coverage and ensuring continuity of business operations. FEMA is the U.S. federal government agency that helps people before, during, and after disasters. FEMA supports citizens and emergency personnel to build, sustain, and improve the nation's capability to prepare for, protect against, respond to, recover from, and mitigate all hazards. FEMA is responsible for emergency management within the United States and its territories. Its headquarters are in Washington, D.C., and it has 10 regional offices across the United States. FEMA's responsibilities include financial assistance, grants, the National Flood Insurance Program, flood maps, National Incident Management System, training and education, hazard mitigation, and disaster response plans. NIMS is a standardized approach to incident management that is applicable to all jurisdictional levels and across functional disciplines. It is applicable across a full spectrum of potential incidents, hazards, and impacts regardless of size, location, or complexity. NIMS provides a flexible framework for all entities to work together more effectively. NIMS improves coordination and cooperation between public and private entities in a variety of incident management activities. It provides commonality in preparedness and response efforts that allow diverse entities to readily integrate and, if necessary, establish unified command during an incident. It has several key components. NIMS components include preparedness, communications and information management, resource management, command and management, supporting technologies, ongoing management and maintenance. Remember, when disaster strikes, the time to prepare has passed. Preparedness, ensuring personnel qualifications and certification standards, equipment acquisition and certification standards, establishing mutual aid agreements and emergency management assistance compacts, communication and information management, establishing interoperable communications and processes, procedures and systems, setting up interoperable information management systems, resource management, utilizing standardized mechanisms for describing, inventorying, mobilizing, dispatching, tracking, and recovering resources over the life cycle of an incident. Command and management, utilizing a standardized organizational structure, the Incident Command System, as well as a multi-agency coordination system and public information systems. Supporting technologies, utilizing voice and data communication systems, information management systems, such as recording and resource tracking, as well as data display systems. Ongoing management and maintenance, utilizing NIMS Integration Center to have strategic direction and oversight in support of routine review and continual refinement of NIMS. The disaster management cycle. Mitigation, designing structures and systems in a way that minimizes the damage to property and potential harm to people in the event of a man-made or natural disaster. Preparedness. Developing response plans and emergency evacuation procedures, providing training and simulated exercises so that people are ready to act in the event of a disaster. Response. Taking immediate actions to save lives and salvage property when a disaster strikes. Mobilizing resources and organizing people in an efficient and cohesive manner. Recovery. Taking actions to repair the community and bring it to a level of normalcy. By implementing strategies for all phases of the disaster management cycle, we are building resilience. Damages from hurricanes come from storm surge and wind forces. This causes structural and property damage, penetrating trauma from flying debris, blunt trauma from flying debris, electrocution from downed power lines. Mitigation strategies include stormwater management systems, designing buildings and infrastructure to withstand wind forces, managing trees and bushes by cutting and pruning them, and reinforcing building exteriors. Damages from floods come from inland floods and coastal floods. This causes structural and property damage, land erosion, drowning due to rising water. Mitigation strategies include stormwater management systems, designing structures to prevent water intrusion, designing structures to redirect water flow, avoiding construction in flood-prone areas. Damages from tornadoes come from wind forces and thunderstorms. This causes structural and property damage, penetrating trauma from flying debris, electrocution from lightning strikes or downed power lines, blunt trauma from impact forces. Mitigation strategies include designing buildings and infrastructure to withstand wind forces, reinforcing structures, managing trees and bushes by cutting and pruning them, anchoring and securing large and small property. Damages from earthquakes come from the tremor, landslides, sinkholes. This causes structure and property damage, fire hazards from ruptured gas lines, suffocation due to entrapment, blunt trauma from fallen debris. Mitigation strategies include designing buildings and infrastructure to withstand shaking, minimizing construction on sloped land, anchoring and securing large and small property. Damages from blizzards come from extreme cold and wind forces. This causes structure and property damage, accident hazards due to icy conditions, frostbite, and hypothermia. Mitigation strategies include salting roads and driveways, insulating homes and pipes, sealing gaps around windows and doors, shutting off water, reinforcing roof, installing snow guards on gutters. Damages from wildfires come from intense heat and harmful smoke and low visibility. This causes structure and property damage, accident hazards due to low visibility, burn injuries, suffocation caused by smoke inhalation. Mitigation strategies include building structures with fire-resistant materials, reducing the amount of vegetation around structures, keeping property free of debris, managing forests by thinning trees and shrubs. Multiple vehicle collisions can involve light and heavy duty cars, as well as trucks. The damages caused by these events include vehicle and property damage, accident hazards due to road debris, penetrating trauma from flying debris, penetrating trauma from impact, blunt trauma from impact forces. Mitigation strategies include road design, roundabouts, raised crossings, divergent diamond interchanges, safety elements, road signs and markings, lighting systems, smart traffic systems, barriers and guardrails, traffic and pedestrian signals, driver behavior, following traffic laws, avoiding distractions, getting routine vehicle maintenance, and practicing defensive driving. Structure fires occur in commercial buildings, residential buildings, as well as industrial property. This causes structure and property damage, a risk of structure collapse, burn injuries, suffocation from smoke inhalation. Mitigation strategies include designing structures with fire-resistant materials and safety elements, keeping combustible materials in safe areas away from ignition sources, installing fire protection systems, detection, alarm, emergency lighting, sprinklers, and extinguishers, getting routine maintenance and inspections on electrical systems, gas pipes, and appliances. Active shooter events usually take place in crowded areas, large gatherings, schools, hospitals, churches, temples, and office buildings. The damage these cause include property damage and penetrating trauma from gunshot. Mitigation strategies include designing buildings with material and safety elements that offer cover, concealment, and exit routes, issuing panic devices, installing access control systems, surveillance and lighting systems, gates and locks, having security procedures and training for all employees to adhere to. Bombers commit their acts in the same places as active shooters. The damage they cause includes structure and property damage, penetrating trauma from shrapnel and flying debris, burn injuries, blunt trauma caused by shock wave, penetrating and blunt trauma caused by impact forces. Mitigation strategies include designing buildings with materials and safety elements that offer cover, concealment, and exit routes, have deterrence signage, install access control systems, surveillance and lighting systems, gates and locks, have security procedures and training for all employees to adhere to. Epidemics are local or regional events. They can exhaust the healthcare system. They can lead to insurmountable deaths. And the risk is societal collapse. Mitigation strategies include strengthen public healthcare infrastructure, water and sanitation systems, increase public health awareness, practice good personal hygiene, track and analyze data about infectious diseases, vaccinations for infectious diseases, and therapy for mental health. Pandemics are international or global events. They also exhaust the healthcare system and lead to insurmountable deaths. The risk is civilizational collapse. Mitigation strategies include strengthening public health infrastructure, water and sanitation systems, increasing public health awareness, practicing good personal hygiene, infectious disease tracking and data analysis, and vaccinations for infectious diseases. Now that we've discussed mitigation, let's talk about preparedness. There are four components to preparedness for all types of MCIs. For natural disasters, this includes emergency supplies and protective equipment, such as non-perishable food, water, salt, medicine, first aid kit, flashlight, safety glasses, identification documents, cash, and maps. The next component, early detection and mass notification systems. This includes satellites, Doppler, Doppler radar, hurricane hunters, sensors, weather balloons, seismometers, seismographs, integrated public alert and warning systems, wireless emergency alert systems, broadcasting, national oceanic and atmospheric weather radio. The next component, evacuation and shelter in place procedures, guidance from local authorities, adequate fuel and reliable transportation, shutting off utilities, securing the building, exit routes, checkpoints, evacuation centers, modes of communication, safe room, evacuation and shelter in place drills, community emergency response teams. Last component of preparedness is estate planning and insurance coverage. Having advanced directives, having a safety deposit box, a will, living trust, durable power of attorney, homeowners and renters insurance, commercial property insurance, disaster and auto insurance, health, life, and disability insurance. Preparedness for accidental incidents. Emergency supplies and protective equipment. Again, non-perishable food, water, flashlight, batteries, radio, compass, binoculars, whistle, fire-resistant clothing, parachute, lifeboats, pen and notepad. Detection and alert systems, accelerometers, inclinometers, gyroscopes, radar, sonar, LiDAR, satellite, telematics and fleet management, OnStar, personal safety apps, fire detection systems, notification devices, bells, horns, strobes, manual pull stations. evacuation and safety procedures, first aid skills, land and water navigation skills, safety skills. Again, estate plan and insurance coverage, health, life, and disability insurance. Preparedness for man-made incidents, emergency supplies and protective equipment, a multi-tool, knife, life jacket, hazmat suit, Kevlar vest, helmet, cut-resistant neck guard, pen and notepad, surveillance and alert systems, broadcasting, closed-circuit television, emergency notification systems, geo-targeted notification systems, verbal and physical codes and signals, panic alert buttons, evacuation procedures and defense training, exit routes, first aid skills, threat identification skills, self-defense, and cybersecurity skills. And as always, estate plan and insurance coverage, health, life, and disability insurance. Preparedness for health-related incidents, emergency supplies and protective equipment, identification documents, cash, maps, early detection and mass notification systems, biosensors, satellite data, habitat mapping, molecular test, epidemiological surveillance, emergency notification systems, evacuation or shelter-in-place procedures, guidance from local authorities, social distancing, quarantine. And as always, estate planning and insurance coverage. Get it. Now that we've discussed preparedness, let's talk about response. Response to natural disasters. Scan yourself for injuries. Get to a safe location. Organize and mobilize resources, people, and supplies. Conduct search and rescue operations. Render emergency medical care if it is safe to do so. Establish an emergency operations center as well as an emergency shelter. Response to accidental incidents. Scan yourself for injuries. Get to a safe location. Contact the local emergency response agency. Organize and mobilize resources. Provide first aid if it is safe to do so. Gather as much information as possible about the accident. Maintain communication with emergency responders. Response to man-made incidents. Run to a safe location. Notify others about the active threat. Contact the local law enforcement agency. Inform them about the active threat. Hide in a secure area that provides cover and concealment. Wait for law enforcement or fire and rescue to eliminate the threat. Organize and mobilize resources, people, and supplies. So, what is the role of the first responder in all this? The first responder's role is to save lives. There are two approaches to MCIs to immediately identify people who need help. The first is START, simple triage and rapid treatment. Locate patients or victims. Assess their airway, breathing, circulation, and mental status. Tag black for deceased persons. Tag red for persons needing immediate care. Tag yellow for persons needing delayed care. Tag green for persons needing little to no care. Render care according to the severity of the person's condition, indicated by tag color. The second method or approach is SALT, sort, assess, provide life-saving interventions, treatment, and transport. Sort patients or victims based on movement ability or responsiveness. Any person that can walk should be tagged green. Waivers will be tagged according to their condition. And any person who is still and unresponsive receives immediate attention. Assess their airway, breathing, circulation, and mental status. Perform life-saving interventions. Open airway, control bleeding, begin CPR. After all this is done, begin transport to an appropriate healthcare facility. Provide advanced life support along the way.